compassionate care and feeding of spiritual evolution in Brazil and a 140-year-old tradition. I like to keep this in perspective that the Spiritist, especially the Spiritist psychiatric movement, has been going on for a considerable period of time. And so they've had the opportunity to continue to amend and improve. And I know specifically at the Hospital Andre Luis, they're doing a lot of research still, trying to improve what's being offered there. So the picture here is not from Brazil, but it is a spring. And I like to think that the paradigm that has been cultivated and developed in Brazil will be like a spring that is contained and can be spread then throughout the world. It's a fabulous paradigm. I've been totally impressed with it. So what I'd like to do is, first of all, introduce you to a lady slipper that I took this picture yesterday. This is a very rare plant that grows in very unusual circumstances in Vermont, a lady slipper, which is part orchid. So I wanted to just show off a little bit from my the area where I live. But in my talk, what I'll be covering is how I came to study Spiritism, some of the principles of Spiritism, talking about Spiritist centers as well as psychiatric hospitals in Brazil, and more on the Spiritist treatments that are available, and some resources for further learning, and my contact information, and then we'll go on to Q&A. So some of you may have heard of John of God. He is not so much in the news anymore because the shadow element of his life came forward about 8 years ago. But prior to that time, he was seeing up to 3,000 people a day. And I was a guide there. I brought 60 different groups who were coming for healing to his center. And I created also a documentary film. I had lots and lots of proof that people who came there, not everyone had physical healing, but people had tremendous amounts of healing, typically physical, but also with people, let's say in 4th stage cancer, they reduced their fear of passing over and came into a state of peace, which was a healing within itself. So I was impressed with what was going on there. But I also, after reading books and meeting friends who were Spiritist, I learned that he is not a Spiritist, but there is still a lot of confusion about that. People will assign the name of Spiritist to John of God, although he never was a Spiritist and never claimed to be a Spiritist. So from the center, I was invited to go out to other Spiritist hospitals and Spiritist centers throughout Brazil. And so I have visited many over the years. I started visiting these centers in 2001. And for the next 11 years, I spent 6 months out of every year in Brazil studying about Spiritism. So to go into some of the principles from the way I see it, and I hope it's not in conflict with the wonderful Spiritists who are listening tonight. So I would say about the philosophy of Spiritism, one thing that has impressed me is that they're not proselytizing. They are offering classes and an opportunity for people to talk about why are we here on Earth anyway, and contemplate the notion that we're here to evolve on a spiritual level. Cause and effect, or the golden rule, is also absolutely central to the beliefs. And one of the things that makes them similar to spiritualists is they describe the interaction with spirits and where the spirits live, where we go when the body dies. So this kind of description is written about in Allan Kardec's books. He wrote the foundational books in the 1860s. And these books are still available and have been translated by several people. So one of the things that becomes extremely important and was certainly a big part of learning about Spiritism for me is they recognize that on the other side, meaning those who are no longer in body, there is a spectrum of ignorance to intelligence, which is similar to what you might find, well, at least what I might find in the United States. I won't say about Australia, but generally speaking, you find throughout the world population a spectrum of ignorance to intelligence. So therefore, it behooves us, if we're going to be connecting with people or beings on the other side, to ask specifically and only for those who are of a very intelligent nature and have cultivated their intelligence and their wisdom, as well as their compassion. So Spiritism has been known also for a kind of exorcism, which has been translated into English as disobsession. But unlike some of the religious organizations that practice exorcism and basically throw out those beings who are not in body, but throw them out on an astral plane into like a fire where they would be destroyed, the Spiritists feel that we need to help all beings, whether they're in body or not in body. We need to help liberate them so that they can go into the light. And so that was practiced consistently over all the years that I was in Brazil and all the places I visited. Also, even though they believe that there's cause and effect, thus karma, they don't feel that illness or the need for surgery is a punishment, but that any kind of illness or physical issue is actually a doorway through which we can grow and evolve. And so they treated people who we would say were ill in quite a different way than we treat them in conventional hospitals. So the only symbol really for Spiritism is a triangle. And if you can imagine that there are three equidistant points, one represents science, the other philosophy, and the other religion. So, or actually more to the point, I think even is ethics, because Spiritism is not considered a religion, but it has a very, very strong ethical or moral base to it. And Kardec himself, back in the 1860s, said very clearly that science is more important than anything that will come from mediums. In other words, he was really affiliated with a scientific point of view, and also was able to interview enough mediums that he could collate what they said into a coherent philosophy. So some of the other beliefs, our creator, also known as God, is unlimited, supreme intelligence, eternal, immutable, unique, omnipotent, supremely just, and good. We are each a spirit having a human experience. We each have free will. And as spirits, we continue learning to become more loving and wise between lives and in and out of a continuum of lives. So as spirits, we communicate with each other in various ways. There's certainly lots of similarity with spiritualism. So I wanted to tell you the story of Marcelo. This is not his picture, but he has given me permission to tell his story so you can get even some more dimension after Helen's wonderful story. So Marcelo actually came from a quite privileged family in Sao Paulo. It was a Catholic family, and his father was a banker, and he didn't have any significant trauma in his life at all. In fact, he had a nice circle of friends, and he was working up to the point he was about 26 years old. And then he became depressed. And his parents, wanting things to go right for him, took him to a really good psychiatrist in Sao Paulo. And he was diagnosed with depression and given meds. But unfortunately, that was not helping him to overcome his depression. In fact, he started to have things going on like hearing voices, oftentimes two or three at the same time. And along with that, he started having the energetic experience of rodents and other small animals and bugs crawling up and down his arms. So he would constantly be trying to take them off his arms. And he was quite irritable, as anyone might be, having that particular sensation going on in their body. And of course, going again to the psychiatrist, and the psychiatrist assessing that he was from a conventional psychiatric point of view, he was having delusions and hearing voices, and that clearly meant that he was likely in a psychotic process, possibly a schizophrenic. So he was given antipsychotics and put into a conventional hospital for observation. But over the couple of weeks that he was there, he lost weight, he became more depressed, his the things that were going on with him that were so unusual did not stop. And to make a longer story short, eventually his parents decided that it would be safe for him to try going to the Spiritist Psychiatric Hospital in Palmello, the same town that Helen told us about. But instead of it being in a hotel, he was literally in an institution, which they called a hospital. So it was contained, and there were other people who were psychiatric patients there. And the hospital at that time was run by a person who was very capable as an administrator, but he was also an extraordinary medical intuitive. So he could tell quite quickly, after Marcelo had the conventional kind of assessment done by a doctor, medical doctor, as well as a social worker. He went to the person who was, again, head of the hospital and the medical intuitive, and this man could see that he was actually a very gifted psychic in the rough. In other words, he'd grown up in a Catholic environment. He had absolutely no language for anything having to do with channeling or being psychic or any kind of the effects that can come with a psychic opening. The only way he knew to even think about it was to say, well, that's part of the lunatic fringe, and I don't want to go there because that would mean I'm a lunatic. But because Palmello as a community had was able to bring him in to meet other people who were also gifted, who had harnessed their abilities, he began to realize that not people who were had psychic abilities were not necessarily lunatics. In fact, he had a great deal of fellowship with them and entered into a training. Even when he was still in the hospital a bit, he was getting some training, but pretty soon he had reduced his medication under supervision, reduced it to a very small amount, was living outside the hospital, taking training with other mediums who were increasing their abilities as mediums, and he was going back into the hospital to do energetic healing work with the patients. So it's an extraordinary story. And when I met him, he was like this man you see here, smiling, happy, and his parents said to me with tears, they said, "We have our son back." And his father, the banker, had left banking and had also taken up the training to be a healer and a medium. So I don't know of any other story like this in the United States, or and maybe there is in Australia, but I haven't heard about it in Australia either. So just a little bit about Spiritism the way it is now. As I was trying to quantify how many people really are attending Spiritist centers, I found out that the governments will report that about 1% or maybe 2% of the people are reporting that they are Spiritist. However, 20 to 40 million people will go to the Spiritist centers, including the Spiritist hospital, in order to get spiritual treatment for whatever it is that is ailing them, either on a psychiatric or a physical level. So that's about a fifth of the population who will make use of these Spiritist centers. And a fifth of the population is about 20 to 40 million people. So I was told that there are about 13,000 Spiritist centers. They may be small, in other words, happening in someone's living room with only about 5 people, or they may be very large. And if you, with some amusement, I thought there are so many of these Spiritist centers. They're like convenience stores. They're around almost every corner. And so I likened it to a convenience store for spiritual health care. And I hope that's not offensive to anyone. I'm just trying to say they're very available. And one of the things that make them so different, make life so different in the United States, is that we have nothing like this at all, especially that would be so available all over the country. So the Spiritist centers make a point of the spiritual care they offer as being complementary to allopathic care. They don't want to replace allopathic care. One of the things that they feel is extremely important for people as in their process of spiritual evolution is organized charitable giving. And so with the larger Spiritist centers that I visited, there was always a great emphasis on charitable giving in various forms. One of the things that people look forward to when they visit a Spiritist center is Reiki-like energy treatments, which Helen called accurately the passe. And another thing that is used there is water that has been infused with very positive healing vibrations, which we might call blessed water. I explained to you that Marcelo had a diagnosis through a medical intuitive, and some of the psychics who are highly trained have a very accurate diagnostic abilities. One of the things that Luis was mentioning a little while ago was that fellowship is extremely important. And I saw that posted in one of the first Spiritist centers that I visited, which was Fraternidade is everything. And I think we would translate that in the English language as fellowship is essential. Again, I mentioned that there are classes that are offered not to proselytize or to demand a person's allegiance to Spiritism, but more to allow people to discuss some of the things that are so important to everyone, which is, why are we here anyway on Earth? What's it all about? And to be able to openly discuss that with people who may be quite different than you are. And the Spiritist centers do open their doors and welcome people of all cultures, all sexual orientations, all ages, etc. So it's a very welcoming community. Now, inside of the larger Spiritist centers, there's training for healers and mediums. And as I mentioned, Marcelo took advantage of that. And it was free, the training for healers and mediums. Another practice, which has been translated as spirit release, is what is often translated in the Spiritist literature as disobsession, which means if a person is burdened by an attachment from a negatively motivated spirit, there can be a meeting that is oriented towards helping that negatively oriented spirit to release and go into the light. So all of this is offered for free. It was stunning to me and awe-inspiring when I realized this. So a big question comes up. Some people will say Spiritism is a religion, but I think it's important to take note there's no priesthood, no rituals, no membership. People can maintain autonomy if they want to. There are no churches and no icons. Spiritism and the Spiritist houses, as well as the psychiatric hospitals, are simply offering a way of life that supports inner transformation, or as I called it, evolution. And Kardec differentiated Spiritism and spiritualism. Both have meaningful contact between the spirit world and humans, but Kardec said Spiritism is not a religion, and he wrote the foundational books. So I like to go back to what Kardec himself said, even though there are many people who will call Spiritism a religion. And I would say that along with what we've already heard from Helen and Luis, that one of the things that Spiritism does that not all spiritualists do is they make it very clear that the goal of their work is evolution. Whereas in spiritualism, some people are attracted to it because of the phenomena. So there are many unusual phenomena, and I'm sure this group is extremely aware of that, but there are many phenomena amongst that spiritualists are researching, which doesn't make them bad or wrong at all, but it simply may differentiate them from spiritists who are mostly interested in evolution. So I mentioned that there are about 13,000 Spiritist centers in Brazil. You can see here, this does not look like a church, but I took these photos myself when I was in Porto Alegre. But in this particular center, which looks an awful lot like an office building, there are hundreds of mediums and healers who are becoming trained to work in groups together to help others. And the training oftentimes takes years and, again, is free. So the Spiritist centers, the larger ones that I visited, are all very simple in design. They're funded by donations, which surprised me a lot, especially some of the more elegant Spiritist centers. Almost everyone who works there is a volunteer, except cleaning and cooking staff and one or two administrators in the larger Spiritist centers. So there are 50 Spiritist psychiatric hospitals in Brazil. And one of the wonderful things that I've been able to do is meet some young psychiatrists who are now bringing new energy and research to the study of spirituality and health. And they rarely speak of Spiritism itself because it's not a word that is well known outside of Brazil, and even in Brazil in some quarters. But the man in the center, Alexander Moreira Almeida, just won an award from the American Psychiatric Association for the tremendous research and publishing that he has done in the whole field of bringing spirituality to bear in psychiatric care. So he's written over 200 articles. I think it's 230 or 40. And he also is quite prominent if you look for him on YouTube. So as a result of the work, there's a kind of revitalization, I would say, about the work that is involved with bringing spirituality into healing. Now, Helen mentioned that she had gone to Goiânia and gone to a psychiatric hospital there. And I take people there once a year for a 7-day seminar. The hospital is called Casa Euripides Barçanufo, after a leader in Spiritism. And who you see here is Jeziel Ramos, who's the president of the Casa Euripides and a psychiatrist. He was explaining to one of my groups some of the work that they want to see done to expand not only the hospital, which is very much there, as well as an educational service for youngsters as well as a community center, but they want to expand so that they can accommodate more people. And as you heard, it is created on an old farm, so there's access to nature and animals. They do have modern buildings there as well as some older buildings, and they're very open to doing research there. I was impressed when I first went there because of their cautious use of psychiatric medication. They do have the full closet full of the medications that are used in conventional hospitals in certainly in the United States, but they do not practice ECT or electroconvulsive therapy. The psychiatrists there, this impressed me so much. The psychiatrists collaborate with mediums and healers. In other words, they don't see themselves in a hierarchical structure with a psychiatrist having more authority than mediums and healers. They consider that they're working together as a team. And from my point of view, as someone who's interested in research, they're keeping excellent records for to contribute to research in the future. A dear colleague of mine is Jeziel Ramos's sister, Dagmar, who is also an MD, psychiatrist, and Spiritist medium. Both Jeziel and Dagmar grew up in Spiritist with Spiritist parents, so it's been with them all their life. Dagmar herself has a private practice. She's a supervisor of mediums at a Spiritist center called Ramachis. She's also a homeopath. She practices the Barbara Brennan method. She's a master teacher of Hellinger family constellation. And again, she's one of my colleagues in Brazil. But one of the reasons I wanted to introduce you to her is because she is not just a Spiritist. She keeps, like several of the Spiritists actually, expanding out and understanding what else would be useful for healing. And for instance, with the Hellinger family constellation work, she's brought that into the Spiritist Psychiatric Hospital, and it's been very popular with the patients. So the treatments, I won't go through this whole list because my guess is that this particular group that I'm speaking is very aware of the positive impact that meditation and prayer has on not only our lives, but those people who we pray for. And the reduction of depression, for instance, the reduction of being triggered easily, and the amelioration of pain, just to name three. So meditation and prayer is practiced in the Spiritist centers and the hospitals. Helen spoke about energy passes. I'm expressing it in the more English way. And if you recognize here that the people who are seated in chairs are the ones receiving the energy work. The people who are dressed either in a purple skirt or an olive color suit are the pass givers who are offering the energy for the people who are seated. And those who are behind the pass givers are actually spirits who are contributing to the success of the energy work. And they imagine, I don't know if imagine is the right word. Let's say they experience that either the energy for healing comes directly from God through into the pass giver, who then, like an empty reed, passes it on to the one receiving the energy work, or it comes through the Spiritist doctors who are not in body directly into the pass giver, who then donates it to the person who is seated and receiving. Very rarely does the pass giver give of their own bioenergy, and that's a very important distinction. And it also allows the well-trained pass givers to give many of treatments to people without getting drained, because it's the energy coming from God directly, or the spiritual doctors that are offering the energy that is then passed over to the people receiving. Now, for the disobsession meetings, they're held in very simple surroundings. I've been to many in many different hospitals. So this looks like a board meeting room. To me, anyway. There are no candles, no religious symbols, no incense or drugs, and no plant medicines. So what you might see if the mediums were meeting is a boom box, and so some music, maybe classical music, would be played right before the mediums are going to begin their work. And that is just to be a calming influence and help people move into a more expanded state of consciousness. So another thing that you might find, especially if this disobsession is being given in a hospital, is that there's a record keeper there taking notes, as well as a supervisor who is minding the whole team of mediums and helping assign certain tasks to certain mediums, as well as at the end, making sure that everyone is balanced and ready to go and will be able to be safe if they're driving home. So generally, there are about 8 highly trained mediums who participate in the disobsession. Some of them may be medical intuitives, and some may be past givers, and some very amazing mediums who can even go into channeling the negative spirits who may be affecting someone of the patients. And of course, this is pretty exhausting work. It takes a great deal of concentration, and also a great deal of sophistication from the mediums, because after channeling a very negatively motivated spirit, they need to also come back into themselves completely without being absorbed still in any affect from the negative spirit. The meetings last about an hour and a half. They focus on about 4 people, not more, and they do the people in sequence, not simultaneously. And what they're asking is there an unhealthy relationship with a disembodied entity that a patient might be experiencing? And then they want to help that entity go to the light and help the patient be relieved of obsessing thoughts so they can refocus on evolution and connect more with the evolved spirits and or Christ. So looking a bit at the results, I just wanted to show a picture. Alex, I saw this picture before I met Alex, and this was done by Alex when he first entered the hospital. And Alex was entering the hospital and knowing that he would likely be there living in the hospital because of the nature of his illness. So to my frame of reference, this shows a great deal of darkness as well as some chaos, and how wonderful that he's able to express what he's feeling in color and image. But it's a picture that's relatively dark. Now, 2 months later, after being in the institution and having the energy passes and also the disobsession that was offered, this is the painting that the same man did. And I find it to have a lot of balance, not only in the lines, but also in the design itself, and with the colors. An extraordinary painting. So Alex is the one in the wheelchair on the left here, and he has a great deal of spasticity. He's not really able to talk at all. And the man on the right was someone who was a friend of mine, who actually goes into the hospitals to be a friend to the ones who are living in the hospitals. So I hope these pictures tell you about the tremendous transformation that can happen in some of the worst of circumstances. Now, I created a book that collates a lot of the expressions of Spiritist psychiatrists, as well as giving perspective from American and English-born psychiatrists about Spiritism. And this is available through Amazon and probably through your local bookstore. So I was very happy that I was allowed to use Alex's painting on the cover. So some more resources as we come to an end. I did create a co-produced a film called Spiritism, Bridging Spirituality and Health. It's available on Vimeo, and it can be rented for $4, I think it is. And then the 7-day seminar on location in Brazil. This year it will be November 8th to the 16th. And if you want more information, the URL is right there for you. You might want to take a picture of this slide if you're interested. And then we also have a course at IMHU. I'm the executive director of Integrative Mental Health University, and we have several courses, one of which is online and allows an armchair visit to the Spiritist centers and speaking with Spiritist leaders, even one from the hospital Andre Luis in Belo Horizonte, with one of the lead psychiatrists there who is actually training medical school students. And this is a picture from 2024 of a group of mediums. They're all with white coats. And the people who are not in white coats were people from my group who were visiting. We had a wonderful evening all together on one of the days of the seminar. And this is my contact information. I'm also available for personal consultations. My specialty is spiritual emergence and emergency. And I've been trained as a psychotherapist. So I just want to say thank you very much for your attention. And I'll come back to you for a Q&A.